Classification of fractures. A fracture is a break in the continuity of the bone. Mnemonic to remember classification of fractures. Chachi is fed up. So C for cause, C for complexity, F for force, E for external environment, D for displacement, and P for pattern. Let's see the first classification, which is based on the cause of fracture. The mnemonic to remember this is PT Sir takes stress. So P for pathological fracture, T for traumatic fracture, and stress for stress fracture. Pathological fracture, the cause is because of some underlying disease. There is no trivial or force required. For example, the fracture through a bone weakened by metastasis. Then we have traumatic fracture. The cause is because of a trauma. That is, when it is subjected to excessive forces. For example, a fall or a road traffic accident or fight. The third one is the stress fracture. It is a special type of fracture which is seen due to chronic repetitive stress resulting in break in the bony trabeculae. It usually presents in the form of pain, and this type of stress fractures are usually not visible on the X-ray. The second classification is based on complexity. This is further divided into simple fracture and complex fracture. Simple fractures are easy to treat, that is, the fracture occurs in two pieces. For example, the transverse fracture of the humerus. The complex fractures are difficult to treat. Here, the fracture occurs in multiple pieces. For example, comminuted fracture of tibia. The third classification is based on force. Here it is further divided into high velocity injury and low velocity injury. In high velocity injury, it occurs due to a severe trauma. For example, a road traffic accident, that is an RTA. Complications, it can result in a severe soft tissue injury, extensive devascularization, unstable fracture, and it is slow to heal. Low velocity injury occurs due to mild trauma. For example, a fall. In low velocity injury, there is less soft tissue injury and the injury heals predictably. The fourth classification is based on the external environment. This is further classified into closed fracture and open fracture. Closed fracture is where the fracture does not communicate with the external environment and the overlying skin and the soft tissues are intact. Whereas open fracture on the other hand is where there is a break in the skin and soft tissues. Therefore, it communicates with the external environment. Open fracture is further classified into internally open and externally open. Internally open means it is open from within, wherein the fracture end pierces the skin from within. Externally open is where it is open from outside. The fracture lacerates the skin and the soft tissues over the bone. It is more prone to infections. The fifth classification is based on displacement. This is further classified into displaced fracture and undisplaced fracture. Displaced fracture, the cause can either be a force or a muscle pull or gravity. Displacement of the distal segment occurs with respect to the proximal segment. These are the three different types. They can either be a shift, an angulation, or a rotation. Undisplaced fracture is where there is absence of displacement. The sixth one is based on the pattern of fracture. So we have transverse fracture, oblique fracture, spiral fracture, comminuted fracture, and segmental fracture. Transverse fracture is where the fracture line is perpendicular to the long axis of the bone. For example, due to bending force. Oblique fracture is where the fracture line is oblique. Spiral fracture is where the fracture line runs spirally in more than one plane. The cause is due to a twisting force. Comminuted fracture is a fracture with multiple fragments. The cause is either because of crushing or compression along the long axis of the bone. Segmental fracture is where two fractures occur in one bone but at different levels. Therefore, this fracture is a combination of two or more patterns. For example, comminuted and a transverse fracture. Now let's see fractures with eponyms. Definition of all these fractures will be inserted at the end. The first one is the side swipe deformity. It is a fracture of the distal end of the humerus and the proximal end of the radius and the ulna. This type of deformity is usually seen when one's elbow is projecting out of the car, is side-swept by another vehicle. Then we have the Colles fracture. It is a fracture of the distal third of the radius with dislocation of the distal radio-ulnar joint. Monteggia fracture is a fracture of the proximal third of the ulna with dislocation of the head of the radius. Smith's fracture is a fracture occurring in adults at the corticocancellous junction of the distal end of the radius with ventral tilt and other displacements. Barton's fracture is also called as the marginal fracture. It is an intra-articular fracture which occurs through the distal articular surface of the radius. Schoffer's fracture is an intra-articular oblique fracture of the styloid process of the radius. Bennett's fracture is an oblique intra-articular fracture of the base of the first metacarpal bone with subluxation of the trapezio-metacarpal joint. Rolando's fracture is an extra-articular fracture of the base of the first metacarpal bone. Mallet's fracture or mallet finger, also called as the baseball fracture, is wherein the finger is flexed at the distal interphalangeal joint due to avulsion or rupture of the extensor tendon at the base of the distal phalanx. Boxer's fracture is a ventrally displaced fracture which occurs through the neck of the fifth metacarpal bone, and it is usually seen in boxers. March fracture is a fatigue fracture of the shaft of the second or the third metatarsal bone. Jones fracture is an avulsion fracture of the base of the fifth metatarsal bone. Jefferson's fracture is a fracture of the first cervical vertebrae, that is C1. Hangman's fracture is a fracture through the pedicle and the lamina of the C2 vertebrae with subluxation of the C2 over C3 sustained in a hanging position. Dashboard fracture is a fracture of the posterior lip of the acetabulum, often associated with posterior dislocation of the hip. Straddle fracture is a bilateral superior and inferior pubic rami fracture. Bumper fracture is a comminuted depressed fracture of the lateral condyle of the tibia. Misonaire's fracture is a fracture of the neck of the fibula. Pilon fracture is a comminuted intra-articular fracture of the distal end of the tibia. Aviator's fracture is a fracture of the neck of the talus. Whiplash fracture or a whiplash injury is a cervical spine injury where sudden flexion is followed by hyperextension. Chance fracture is also called as the seat belt fracture. The fracture line runs horizontally through the body of the vertebra, through and through to the posterior elements. Colles fracture is an avulsion fracture of the spinous process of one or more of the lower cervical or the upper thoracic vertebrae. Pott's fracture is a bimalleolar ankle fracture. Cotton's fracture is a trimalleolar ankle fracture.